We met at a downtown restaurant in New York in August 2004. We wrote down sort of the key constitutional items on a napkin that was at the table, and that's how it was born.
We are a truly global organization with counselors from all the 5 continents. More and more reinforced forces from Asia, from Africa, and from the different continents, including Australasia.
It has been such an amazing journey over 20 years that when I look back at it, it's almost astounding to recall that we used to treat our patients by covering them with tar, and now we can give them medications 3 or 4 times a year that make them almost forget that they have the disease.
The IPC needs to work with patient organizations, with other dermatological organizations. In other words, the community needs to come together so that we can advance our field and improve the life of people with psoriasis.
Well, the IPC really helped me to connect with, to have a network beyond the borders of my own country, and to get a total different perspective of what is psoriasis care and research beyond the borders of my own country.
One is a big genetics project where we have stimulated actually to get insights and have contributed to get insights in the genetics of psoriasis.
And because of the IPC, I was one person that I was lobbying my own government in order to allow patients access to biologic treatment, and I was successful in doing that. It's now part of the National Health Insurance.
So psoriasis is a chronic, painful, disfiguring and disabling non-communicable disease. These are the words of the WHO.
We are so proud to see how our young dermatologists that have been previous fellows for us, now they are leaders in psoriasis field in their countries.
IPC does an amazing job of taking young dermatologists from around the world and partnering them with other leaders in the field of psoriasis globally.
IPC is the organization to keep going with the medical education and promoting awareness of psoriasis and the systemic nature through their courses.
I would go a little bit beyond the academic. I think what it really brought is the friendships, the relationships we made with all the colleagues during all these years. People from all over the world, ranging from continent to continent, and this is something certainly that will never disappear. These friendships will keep forever in life.
I think that the IPC will continue expanding worldwide, reaching even remote places to improve early diagnosis, early treatment, and access to treatment for patients with psoriasis.
Most people with psoriasis don't see a dermatologist. They see, if they're lucky, they see someone who is skilled in diagnosing and managing the condition. And our role is to actually transfer those skills of diagnosis and management to non-specialists. That would make the biggest difference to the largest number of people around the world. And if we can do that, we have truly succeeded.